Hello, and welcome to Module 1 of the Sensory Workout Series. We've committed to making physical activity more accessible and enjoyable for everyone. Join us as we share our knowledge of exercise and sensory processing to help you feel confident and have better understanding of how to adapt physical activity to your needs. Join us for a series of modules as we break down and really simplify physical activity with resources and activity suggestions. In this video, we're going to talk about sensory workouts. What is sensory workout? Sensory workout is a program that combines what we know about exercise and what we know about sensory processing to make physical activity more accessible and enjoyable for all. In general, the goal of these modules are to provide education, resources, and activity suggestions that can be used by persons supported and caregivers to reduce barriers around physical activity and to increase overall participation in physical activity. Remember, each person is unique, so activities should be adapted to suit the participants' needs and abilities. We also want to acknowledge that everyone is different, and not everything in this module will be relevant to you or to the person you are supporting. Our goal is to share general information, and hopefully there will be some parts that you can relate to or benefit from. Disclaimer: the information in this module is very general and does not replace the advice and guidance of your healthcare providers. Always follow their advice first and foremost. If you have specific concerns, challenges, or questions, please seek out support from your general practitioner or an appropriate healthcare provider. Today's module is an introduction to physical activity, why physical activity is so important, and how we can increase our physical activity levels in a safe way. So, why exercise? Oftentimes, people automatically think about the physical benefits associated with exercise, but there are so many other benefits, ranging from benefiting your mental health, your emotional health, your social health, social well-being, and of course, your physical health. If we exercise regularly, our bodies will get stronger. Physical benefits include lower blood pressure, lower blood sugar, improved cholesterol levels, build stronger bones, strengthen muscles, improve digestion, increase balance, coordination, and flexibility, reduce the risk of falls, and help you achieve a healthy weight. What that means is that exercising regularly can make it easier to complete tasks of daily living. Things like walking up and down the stairs, getting in and out of the bath or shower safely, getting up easily from a comfortable chair, carrying groceries, and shoveling snow. All of this sounds great. But what if we're not even motivated to get started? Then what? The motivation to get started can sometimes be difficult, but once you get started, there are major benefits, and it does get easier. We will discuss motivation in more detail in a future module. Physical activity can improve psychological well-being, enhance mood and overall emotional well-being, reduce feelings of depression, anxiety, and stress, balance energy levels, and improve sleep. So what does this mean in terms of everyday life? This means you may feel happier or more calm, you may sleep better at night or feel more rested, you may have more energy to do other things you love to do, and you may feel better about yourself. Along with the emotional benefits, there are quite a few sensory benefits to physical activity. Benefits include a calming effect on the nervous system, but also an alerting effect on the nervous system, increased focus and attention, improved balance and posture, improved self-regulation, and increased body awareness. So how much exercise is enough? The bottom line is, the more you're moving, the better. The Canadian Physical Activity Guidelines can give specific guidelines for adults between the ages of 18 to 64. To achieve health benefits, adults aged 18 to 64 years should accumulate at least 150 minutes of moderate to vigorous intensity aerobic physical activity per week in bouts of 10 minutes or more. It is also beneficial to add bone and muscle strengthening activities using major muscle groups at least 2 days per week. More physical activity provides greater health benefits. While exercise is a vital part of a healthy lifestyle, it is important to take precautions when beginning a new exercise program if you have an otherwise sedentary lifestyle. Please consult with a doctor before beginning a new exercise routine. Take extra precautions if you or the person you are supporting is over the age of 69, is currently taking medications for blood pressure or a heart condition, has a heart condition and their doctor has said that they should only do physical activity recommended by a doctor, has a known bone or joint problem, for example, back, knee, or hip, that could be made worse by a change in physical activity, loses balance because of dizziness or loses consciousness, and experiences pain in the chest, either during physical activity or at rest. For many people, including those recovering from previous heart complications, a slow and steady approach to starting exercise is recommended. You may ask yourself, is it normal to feel this way while exercising? During slow and steady exercise, it is normal to feel comfortable, aware of your own breathing but not out of breath, able to talk, slightly tired, dry skin or slightly sweaty, and relaxed. However, during slow and steady exercise, it is not normal to feel pain, pressure or heaviness in your chest, neck, jaw, shoulder, arm, or back, dizzy or lightheaded, cold and clammy, an overwhelming or unusual sense of fatigue or weakness, nauseated or sick to your stomach, or a sense of anxiety or foreboding. Stop exercising and seek medical attention and/or call 911 if the participant is experiencing chest pain, the participant becomes unusually sweaty. For example, is the participant sweating during an unusual component of the class or at an unusual rate, perhaps seemingly out of nowhere? The participant is experiencing a sharp or unusual pain in joints or muscles. The participant is feeling nauseous. The participant is experiencing difficulty breathing. The participant is feeling lightheaded or dizzy. Or the participant becomes unusually pale. To summarize, here are key safety considerations to remember while exercising. Listen to your body. Warm up and cool down. Increase activity level, the intensity and the duration gradually. Drink plenty of water. Eat food that will nourish your body, and wear the right type of clothing and footwear for the activity. Remember, exercise should never be painful. It's normal for our joints to creak a little when we move in new ways, but exercising should never hurt. If something hurts, stop right away and tell an adult who cares for you. It's okay to be a little bit sore after exercising. This means your muscles are getting stronger. You can go for a slow walk, stretch gently, take a warm bath or shower, and rest. We hope you have found this Module 1 video useful. Please share any of our videos if you feel they are helpful. Check out our newest videos for sensory workout activities to try at home. Thanks for watching!